Dr. Howard. He's presenting a case study on pulmonary artery intimal sarcoma. And I'm going to give you a brief introduction to this incredible man. So, he is an anesthesiologist, author, and inventor, and founder of the Hippocrates Research Foundation. He received his undergraduate degree in pharmacy to give a phenomenal basis of understanding pharmacological reactions in the body from Ferris State University in 1985, and then a medical degree from the University of Texas in Houston. And then he continued his studies, completing an internal medicine internship and an anesthesia residency. While attending medical school, he worked as a pharmacist and participated in the setup of an operating room pharmacy, instituted a novel cassette drug delivery system for the Department of Anesthesia, and published pharmaceutical research. He received a patent for combination anesthetic mask and oxygen transport system, so definitely an active scientist and researcher. Him and his wife, Dr. Michelle Bauman Howard, wrote Anesthesia Review, the first and second editions. And his wife, him and his wife Michelle, are both currently chief of anesthesia for two separate research-resistant depression ECT programs, performing over 3,500 treatments per year. That's incredible. As the co-founder of the Hippocrates Research Foundation, his two proudest achievements as a physician have been reversing his father's stage 3 lung cancer, as well as the detection of his wife's malignant myeloma and ovarian cancers at stage 0 using liquid biopsies. So thank you so much for your contribution to this field. We are very excited to hear your case study, and let's give it up for Dr. Howard.
Thank you.
Hey Trey, where's the laser pointer?
Should be right up there on the. Yeah.
Like the, do you know what
It's
your
a
mouse
button
pointer?
at the top.
There we go. Okay. Thank you.
Thank you. The history and synergy in this room is unbelievable. We could make a movie on it. So in the back of the room, Daniel Arago. I met Daniel 7, 8 years ago. He was in charge of cancer research at Quest Nutrition. He was a director of the Keto Pet Sanctuary. At the same time, they were trying to buy the Oncoblot test and Capsol T. So Daniel and Ron Pina knew Standard Enzyme, SAM, everything about it. And I got introduced, and my wife, she started using Capsol T to reverse her cancer. And it was working. So we didn't really know at the time where to buy Capsol T, and we met a few phone calls. We discovered Sam bought Capsol T, and so there's a huge history with Dr. Moray, Oncoblot, Capsol T, Standard Enzyme, and now it goes into True Rife. And a lot of people don't know True Rife was almost owned by Standard Enzyme. I don't really know what happened, but Sam and I almost bought True Rife together. And then, but all of this goes together, and I'm going to present a case that I think is going to be a landmark case in history. And, I think it's going to be played around the world, and it's going to be a big deal. And it wouldn't have happened without all of this. And I've been here about 5, 6 years, giving talks on glucose monitoring and VO2 testing, fat burning. And I think everyone was probably like, how does this all fit together? And I wasn't exactly sure, but I thought where we were headed in the right direction, and we were going to be able to reverse cancer. And we did it. And that's what I'm going to present. So it's going to be the first case. But before that, I like a lot of thank yous out there. Thank you for Daniel, all he's done. Axana and Joseph Catalgo. Axana, thanks for that great talk yesterday. And I'm going to make a promise. Since Dr. Holt bought a Vital Machine, and we come from the same, you're going to. If he buys one, no, I promise you, in the next year, I'm going to learn how to use a Vital Machine. From my world, it doesn't really make sense, but I keep hearing this over and over again, and we're going to all push this whole forward, and we're all going to be synergistic to each other, because if we can prove, and we have proven now without a shadow of a doubt, that we can reverse cancer without chemo and radiation, and it's a very good study, and you're going to see at the end. It moves all of us up, because everything that you're doing will be validated. And when we can do this scientifically with research, predictably, then all of this moves up, and we're just promoting a very, very good thing. All right, I'll get started. And the reason I picked this case on pulmonary artery sarcoma, very, very rare cancer, only a few hundred cases in the literature. It's universally fatal. And so it's when you pick these type of cases and you have a positive outcome, everyone has to take notice. It's not by chance, because there is no other case history of people surviving and doing well with this type of cancer. Oh, and Amber, thanks to Amber Walchek, and she's going to tell us on Sunday how to integrate the Vital Machine and the TrueRife. And again, in history, Dr. Haver and Mike Tigler, they partnered many years ago, and the TrueRife frequencies are on your Vital Machine, and you can be scanning for it. I don't really know how to do all this, but I'm going to learn how to do this, and I promise you that. And I think that there's some real synergy there, and Amber is already doing it, and it's working, and so she's going to teach all of you how to do that. Just shut it all off. How did I do that? Okay. So this is our patient is a 48-year-old white male from, should say, Victoria, but he presented with shortness of breath. And you can see his hypertension, diabetes, little bit overweight, shortness of breath, and he was admitted to the hospital. They thought he had a pulmonary embolus. That's a pretty good guess, presentation. But his doctors were pretty good. And almost immediately, within a day or so, they did an MRI. He had almost complete occlusion of his pulmonary artery and a big mass in his lung. So that's going to tell you there's probably cancer. So they're very astute. They did something called a PET CT scan. It took up glucose, and that was an indication of cancer. So this kind of brings up another point. A lot of doctors will say there's no, what does glucose have to do with cancer? Even oncologists will do that, but they know that. They're really, because that's the mechanism of a PET scan. The dye, the contrast, given intravenously, is hooked to glucose, and so it's rapidly taken up by cancer, and that's how you know. And with a high standard uptake value, you know there's metabolic activity, and that's cancer. And ideally, we would have done, and this is something that we do with Hippocrates Research Foundation. We have many patients that we work with stage 4 cancer, and this is something that we do and like to do. We want a DEXA scan or a full body, it's called a in-body scan. It's a body composition. We want people with a lot of muscle and really kind of on the chunky side, because we're going to starve them a little bit to get rid of their cancer. And so if they're really skinny and have no muscle, that's a poor prognostic indicator. And there's also something called phase angle that it's been heavily studied. That's the amount of energy in each of your cells. And if it's high, you're pretty much resistant and you're going to do well. And if it's low, you're not going to do well. And I'd encourage you, everyone, to find one of these in-body scans and have it done, and you want a lot of energy in your body. And at TrueRife, we bought one of these $30,000 machines, put it in our lobby. Everyone that comes in, we want to scan them, because what we want to do is show that you put energy into the body and fix different things. Your phase angle goes up and you become resistant to disease. So the standard of care is debulking surgery, because we have to instantly, he's got this pulmonary artery mass. It's choking off the blood supply, so he's short of breath. So instantly we have to cut that out so he can get blood flow. And that's what was done. The alternative standard of care was some chemotherapy, but there's no good science behind it. And then the radiation was thought to be ineffective by the radiologist. So the life expectancy, 6 weeks, and this is out of his medical record. So most of this was done without talking to the patient. So Daniel Arago was really his coach, and there's many patients, and so I have more of a supervisory role on a lot of these things. They tell me about them, but I don't get involved. And so this was all done out of the medical record. So there's the doctors wrote that 6 weeks to live, surgery alone 12 weeks, and 18 to 24 months with chemotherapy. And as I said, the radiation oncologist said that the radiation wasn't going to work. So I don't know why that keeps doing that. Here we go. So here's the patient opted for debulking surgery. It's a 7-hour surgery, required an arterial graft. So they just cut that out, put a graft in. But he had his heart stopped, so that he was on bypass. It was a 7-hour surgery, and the margins weren't clean, so there was still a lot of tumor in there. So here's something that's very crazy. We haven't done really anything new. It's a little bit novel. So what we're basing most of what we're doing is off 100-year-old science, 100-year-old science. And so this Otto Warburg, and you can't dismiss the guy because he won a Nobel Prize, so he's a pretty smart guy. And so he, 100 years ago, figured out that cancer consumes a lot of glucose. It ferments glutamine, and it produces lactate, even in the presence of oxygen. There's going to be a next slide, and it's going to show how normal metabolism and the difference between normal metabolism and cancer metabolism. But he figured all this stuff out 100 years ago. And there's a pretty good book called Tripping Over the Truth. Goes through all of this in the history. So it's not like, this isn't really novel stuff. It's just ignored stuff because, for obvious reasons, doesn't make much money. So this differentiated tissue, that's normal tissue. They call normal tissue differentiated tissue as opposed to tumor. So there's 2 types of metabolism, one with oxygen, one without oxygen. This is called oxidative phosphorylation, very efficient, produces a lot of ATP energy. And then here's anaerobic, without oxygen. So if you're running or something like that, you're going to be anaerobic, and that's normal. It can be a small portion of how you're producing energy, but very quickly you're going to, you slow down because lactic acid builds up, you don't feel good, and it's toxic. But in cancer, can't make my point. There we go. In cancer, even in the presence of oxygen, normally without oxygen is when you make the glucose goes into lactic acid and very inefficient. But even in the presence of oxygen, it's a very inefficient production of energy. And so we're going to key on that, and that's how we're going to reverse cancer. So normal cells, it's written in textbooks, 89% oxidative phosphorylation. In a good athlete, it's 100%. And so my wife, Michelle, which is the fittest person in the room, we've done VO2 testing on her. And even with a heart rate of 190, she's still burning 92% fat. And so normally if we get a heart rate of 150, we're out of breath and we're slowing down, lactic acid is building up. But if you're very efficient, and that's what you want to be. You want to be using oxidative phosphorylation. You don't want to be using and making lactic acid and anaerobic fermentation. So normal cells, they thrive on ketones. And it's energetically flexible. And what I mean by energetically flexible is it can use glucose, anaerobically, aerobically, ketones, oxidative phosphorylation, as opposed to cancer cells. Cancer cells, they can only use this glycolysis, very inefficient source of fuel, and ferment glutamine. And then, so that's energetically inflexible. And so that's the key, that energetic inflexibility is how we're gonna reverse cancer. And it's also very inflammatory. So cancer is a very inflammatory state, makes your blood thick, and all those things we're keying on. So this is just contrast to get a little bit more. So we're calling this metabolic therapies. And so as opposed to standard of care, so metabolic therapies, we're targeting energy production. As opposed to standard of care, we're targeting rapidly growing cells. So it's non-toxic for the most part, what we're doing. Costs about 1% of standard of care. And here's kind of the downside of what we're doing. Patient compliance. 80-90% of the people that we work with, they won't do it. It's really crazy. We used to have kind of, I don't know, judgment. Why would these people, why, if your life is on the line, but if you think about it, they're pretty beat up. Most of them have been through chemo, radiation. Food is a comfort, and they just won't do it, even though that's the answer. And the other thing with what we're doing, we have a plan that now we can get people to stage 0 cancer based on a PET CT scan, and then we're using really everything you're doing along with Rife Machine, and we're going to try to add as many simple things that people can do, because people can only stand this diet for a few months, and it takes about 6 to 9 months to reverse stage 4 cancer, but they can't live their life that way. So they got to go back to a relatively normal diet. I mean, of course, you want a better diet, but a relatively normal diet, and live the rest of your life, cancer-free. And so my wife, Michelle, she's been doing that for about 8 years. And so, and we follow circulating cancer stem cells afterwards. And the problem with, if you just follow standard of care, once they're done with their treatment, they're not following up with circulating cancer stem cells. They just go, good luck, we'll scan you every 6 months or a year, and then it is what it is. But then genetic mutations, there's going to be a reoccurrence. And that's all the things that we do with, we know of at least 100 things that will inhibit cancer, like, there's Capsol-T is a great one. There's many, many things that will inhibit pathways, but eventually the cancer will go around that. It might take 6 months, it might take 5 years, but it will go around that. And so if you're using something like metabolism or frequencies, there's no way for the cancer to go around it. So what we're doing is something called the Press Pulse Protocol, and Thomas Seyfried at Boston College, he coined that phrase, and he wrote the book, Cancer as a Metabolic Disease. So that's really the Bible. If people want to know what we're doing, that's it. There's over 1,100 citations in it, all the science is in it, and it really can't be refuted. So to work with us in Hippocrates Research Foundation, I'm not exactly sure how many patients we have, but it's probably someplace near 40 patients scattered around the world, many clinics. We coach anyone that wants to learn how to reverse cancer, meaning doctors, patients, anyone. We're a little bit short on staff, but we're hiring as many people and getting as many people involved as we can. But to work with us, you have to have a personal physician. That's someone that's going to order standard scans, tumor markers. So we're still using we want to know if we're winning or losing. And so we need standard of care, that type. And so they need a personal physician. But with a press pulse protocol, the biggest piece of it is getting your blood glucose to 65. I gave a talk last year on blood glucose monitors. All that was for a reason. I knew where we were headed with this. We needed to become perfect at glucose monitoring and know exactly what we're doing. And so we've done it. And also with blood ketones, we want the ketones a little bit elevated. And then hyperbaric oxygen at 2.2 atmospheres. We're going to talk about each one of these individually. And there's a whole big science behind each one of these modalities. But there's really only 4 things that we're doing: lowering the blood glucose, increasing ketones, hyperbaric oxygen, and fenbendazole. Well, and then we're going to block glutamine. The cost of it is in the neighborhood of $10,000. And so people gasp, how could it be $10,000? Well, I was just a week or so ago, I was down, and we have a patient that just started our protocol in the Cayman Islands. And so standard of care, he'd already burnt through roughly 900,000. He gets a phone call and says, hey, did you know you have a $1 million limit on your health insurance? He says, no, all of you have a $1 million limit. You can burn through that quick with standard of care. And they don't say, hey, we're going to do the rest of this for free. They cut you off. And so we got this guy, he's on his last nickel. So we're, going to get him through it. And he's pretty late stage, but I think we're going to turn him around too. But it's $10,000. So it seems like a lot of money, but compared with, the millions of standard of care, about 1%. So glucose control, small meals, intermittent fasting. We do use a drug called metformin, berberine. You've probably all heard of berberine, natural substance. Exercise before and after meals. I talked about this last year. If you exercise a little bit before and after a meal, the blood glucose is very stable. A lot of their calories is going to come from olive oil and coconut oil. We have to restrict the protein. A lot of people originally with the ketogenic diet, they would gorge themselves in with steak and all this stuff, and that excess protein is just converted over into sugar. So they were defeating the purpose of it all. And what we're doing is we're decreasing insulin growth factor 1, cortisol production. All of these things are very stimulatory to cancer cells. So to measure the ketone production, we use this little device called a Keto Mojo. That's a blood. And some people use urine. That's not very accurate. As we said before, cancer can't use ketones for fuel. Normal cells thrive on it. There's no risk of ketoacidosis. A lot of doctors will say, hey, you're going to go into ketoacidosis. It doesn't happen. It's only type 1 diabetics that go into ketoacidosis. You can't put someone into ketoacidosis with this type of diet. Long term, you could present kidney stone. So if someone had kidney stone, history of that, we'd want to alkalinize the urine, and there's prescription or non-prescription. Potassium citrate will alkalinize your urine and prevent kidney stones. There's something called keto flu. So when you quit eating carbs, some people, they feel sick, flu-like symptoms. And actually, the patients and Daniel Arago, they're the ones that figured all this out. I didn't figure this out. So that normally you get, fatigue, headache, muscle weakness, and it's electrolyte problem. Who knew? And anyway, they started using these things called thermotabs, just sodium, potassium chloride, and they preemptively give that, and it prevents that. So you smooth transition into ketogenic diet. Hyperbaric oxygen. This is probably the most expensive part of what we're doing, or can be. But and we've had people reverse cancer without hyperbaric oxygen, but it definitely accelerates it. And there's something called hexokinase 2 blocker, decreases tumor angiogenesis, downregulates pentose phosphate pathway. That's how you make nucleic acids for DNA, increases reactive oxygen species. And so that's to help kill the cancer cells. And we follow Dom D'Agostino's work at University of South Florida Medical School. He's done a lot of that work and published it. Fenbendazole and menbendazole, there's many repurposed drugs, and that's kind of a big thing right now. There's a lot of things that are off patent, a lot of prescription drugs off patent, and they just repurpose them for other things. And so this fenbendazole, melbendazole, they happen to be in that class. Fenbendazole is very cheap. Well, both of them are cheap, easy to get, and they fit perfectly in what we're doing, and relatively non-toxic. So we start with a small dose, and we can escalate that dose up. And again, the patients, and Daniel did this stuff. I was really kind of out of the loop, but they pushed the limit. Most people are given, it's a 220 milligram. You can buy this stuff for cats and dogs off Amazon. There's websites promoting it. They're given very, very small doses, maybe up to 600 milligrams range or something. They've pushed it all the way up into the grams, and they figured out how to keep the patient safe. And the toxicity really occurs after many months. But it is, we call it like chemo light. You're going to have the same toxicity, except with chemotherapy, your hair will fall out in about a week. This, if you were really at super high doses, probably take 3, 4, 5 months to happen. And so people with central nervous system tumors, we use mebendazole as opposed to fenbendazole because it crosses a blood-brain barrier. This is called, it's got a long name to it, 6-diazo-5-oxy-L-norleucine. We call it DAWN. Again, there's websites written on this. So many people have all the pieces. They're just really, really close to putting this stuff together, but they never actually get it quite right. And so we just, again, experimented with a lot of different things. And we're using Safe-Read's original protocol, but then we're kind of tweaking it a little bit and figured out how to get around side effects and stuff like that. And that's why we're successful. But it can cause diarrhea and GI discomfort. And they figured out if you eat a salad and take psyllium as a supplement, it prevents those side effects. Also, there's something called adenine B4. It helps with the synthesis of RNA and DNA and decreases the side effects. So they're able to, originally they were at a certain dose, and now they're up to double and tripling the dose so that it's much more effective without toxicity. So the patients really, this is the difference. The patients really have to be involved because we need constant feedback because we're restricting their diet. We don't want them to get too skinny. And so they have to be measuring their weight, measuring their food every day. So it's a whole big production on weighing the food, figuring out the macronutrients and exactly what they're doing because they're tweaking this by the grams of food. And so food's no longer, it's just something you have to do. So eating this food is not pleasurable. I mean, you're eating steak, all right, great thing. But after you eat steak every day for 4 or 5 months, not such a good thing. It doesn't have to be steak. It can be any protein. And but you're just eating protein, almost maybe an ounce or a few ounces of vegetables along with it. But your main calories are going to be MCT oil and coconut oil. So it's going to be a lot of oil. And then, so the patients have to be doing all this weighing of the food. They're testing their glucose, ketones twice a day. They're using this Freestyle Libre monitor. As I spoke about last year, it's really, really inexpensive. It's a $35 monitor, lasts 2 weeks. So anyone can afford the $70 a month. They're recording their dosages of the supplements, medications. And then we have, at the end, you'll see there's Hippocrates Research Foundation. We have a website. They feed all their medical records into a HIPAA-compliant portal. And so we keep track of all that. And that's how we're going to be able to publish all this because we're going to have all the medical records. And so no one can say it really happened or didn't happen. We got proof. So the other piece of this, we're saying that the problem is with energy production. And so there's a problem with the mitochondria. So logically, you got to fix the mitochondria. So that just has to be part of the protocol. There's something called membrane lipid replacement therapy that's coined by a Dr. Garth Nicholson. He was at MD Anderson for 25 years and University of Texas Medical School, where my wife and I trained. And he came up with a product that gets the phospholipids where they're supposed to be through the GI tract. And there's 22 studies on it. So it's pretty, it's called Youthful Energy by NT Factor. I keep trying to get Sam to make copy that product because it's a great product. And then exercise increases the size and the number of mitochondria. Most people don't know that, but you can fix your mitochondria by exercising. So these people, yeah, we want, even though we're starving them, we want them to exercise and build muscle if they can. And then we haven't started it yet, but there's something called cardiolipin, another phospholipid that we think is going to be a piece of the puzzle. And CoQ10 also to help with mitochondria. I just mentioned exercise. The one thing that's a little bit interesting, so you think that your blood sugar would go down when you exercise. It actually goes up. And that's the stress of exercise. So it'll go up about 10 points. And so you really, when you exercise, you want to walk. You don't want to run. So walking is good enough to stabilize blood sugar. Running actually increases your blood sugar. Another piece of the puzzle is balancing the autonomic nervous system. That's a stress response. And the one piece that we don't have, and we've been talking about among ourselves, and we're going to be talking to some of you, that's the component we don't have. We don't have the mental piece of this, and we got to add that in. And eventually we're going to have something called base camps around the world, and there's going to have all this available to teach people how to do it, but that's the piece that we don't have. So wherever Sam is, I think, Sam, we're going to talk to you about the MACE method. So there's a lot of ways you can measure the autonomic nervous system, see if it's in balance. You can look at cortisol. Saliva cortisol has to be saliva, not blood. We use something called trace element hair analysis. Requires a prescription, but that will tell us, and it looks at all the minerals, and you feed that data into a computer, and it'll tell you exactly what supplements. You guys are doing it with a Vital. Sometime, once I get my Vital machine and we start doing this, I'm going to compare the Vital results to the trace element hair analysis. It'll be a lot of fun. The other piece of this is a lot of you guys have Rife machines, and what we think is going on is when you're using a bulb that's 50% magnetic, 50% electric, we think that the electric piece is, people feel that as stress. Some people feel that as stress. Other people don't. Like I don't feel when I use a Rife machine, I don't feel it. Other people can feel it, 20 feet away. They're just sensitive to that stuff. And those are the people, the electric piece of it, they might have a reaction. And I think half the time a Herxheimer reaction is actually a stress response to the electric component of the Rife machine or any other modality you're using like that. And then, so what TrueRife is doing, we're coming out with a mat that's 100% a magnetic, producing 100% magnetic field. And so we're using that on, TrueRife is sponsoring a professional athlete, and she has Lyme disease. And I knew what was going to happen when she first used the Rife machine. Within minutes, she, had a Herxheimer reaction. And but when we used the purely magnetic, she did fine. And actually, she did more than fine. So we treated her just with using a magnetic field and grounding for about less than 2 months. And this is a lady that had won 5 world championships, and she's 42 years old, but she hadn't really trained much in a year because she just didn't feel good with the Lyme disease. And so we worked with her for less than 2 months. She entered a professional race and she won it. She qualified for the world championship. And then a month later, she finished 5th in the world. And that's not after she hadn't been able to train, still has Lyme disease and all the rest. So next year, we're almost for sure she's going to win her 6th world championship at the age of 43. So that's the next thing on the horizon. And I think we need to start looking at that when we're talking about energy. What kind of energy is it? And there's a lot of people that know a whole lot more about energy. And I kind of get lost when someone says quantum physics. I don't even know what that means. But and putting energy, we got someone here that can put energy across the room. Again, that's hard for me to get my mind wrapped around, but I'm trying. So this is what the stage 0 cancer maintenance program looks like. So we have to see if we're winning or losing, even though we have no evidence of disease by a total body PET CT scan. So we're looking at things, and so tumor markers are going to be negative or should be negative, but we want to know if we're winning or losing. So we can look at circulating tumor DNA. We can look at circulating cancer stem cells, and we monitor those, and we've been doing that for many, many years on my wife, and we keep those low, and statistically, you won't have a recurrence. Your immune system will keep all that in check, and you won't have a recurrence. So now we're able to get people to no evidence of disease, and we think that we got, I don't know, roughly 8 years of data on my wife and some other people, so we think we can keep people cancer-free for the rest of their life. That also helps. There's 20 million people that think they're cancer-free, that they've been treated, and said that they're, never going to have a recurrence, they're cured. Well, it's just, that's a ticking time bomb. They really should be measuring this stuff, and then we could help them, and we could absolutely prevent that from happening more scientifically instead of just a wait and see approach. So these people, they're off the press pulse protocol, so they're not starving themselves anymore. We still don't want them eating a bunch of, carbs that's going to, and damaging their mitochondria. We want to keep them on the membrane lipid replacement therapy, and then balancing the autonomic nervous system. So my wife, this last year, we just have her doing the Rife machine protocols. So the frequency has a little bit of anti-cancer property to it, or maybe a lot, depending on how much you're using it and how specific you are with it. And then balancing the autonomic nervous system. And her circulating cancer stem cells are as low as they've ever been. And we got 8 years of data on that. So now we're getting more and more simplified for the patient. And that's where you guys come in. We're going to work together. We're going to figure out, there's using the Vital machine and other things like that. We have to make this as simple as possible for the patient, because they can put up with this stuff, but they have to know there's an end to and then I think that exercise keeps cancer away to some degree. And so my wife's working out 3-4 hours a day for the Ironman. I think that if she stops, I think the circulating cancer stem cells are going to go up. But we're going to hopefully she'll keep working out for a long time, and that won't happen. But we're prepared for it. People can try intermittent fasting. I think that's a good thing, and calorie restriction. So what happens, there's a lot of studies on calorie restriction. Most people are probably eating around 2,000 calories a day. That's too much. You can live on about 1,200 calories a day. And even when you're exercising, Ron Pina, he was one of the owners of Quest Nutrition. He used to joke, he was a big bodybuilder, and he joked that he eat less than a rat. And he ate almost no, it was all protein, so for the muscle. And then what happens, if you calorie restrict, everything, just your blood pressure goes down, your pulse goes down, your metabolic activity goes down, and then you're kind of bulletproof to cancer at that point. But it's just a lifestyle and a choice. But we can all get by on a lot less calories. You become very thin, but that's the best way to go. So here's, there's just so many, how we got here was just so many people involved. Thomas Seyfried, he's really the one that had the press pulse protocol. We'd have never come up with that on our own. Dom D'Agostino, he had the answer to the hyperbaric. Daniel Arago and Ron Pina with Quest Nutrition, the Keto Pet Sanctuary, they did this on a bunch of dogs, and it worked. And so then originally they tried it on humans, failed miserably because they cheated on the diet. Then we got the glucose monitor, so they wouldn't cheat on the diet. Sam, I mentioned with Sam with Standard Enzyme, he was in the mix of this whole thing. I wouldn't have even been here, wouldn't have even known any of you if it hadn't been for Capsol T and Sam buying Capsol T. So it's just kind of crazy how this, Dr. Moray, he invented Capsol T, and so we were in talking to him before he passed away. But he was a great cancer researcher, and Sam knew him very well, and we all learned much from Dr. Morey. And then we use RGCC International. They've been in business for a long time. They have circulating cancer stem cells, so we've been using those for many years. That's I don't know how we would really monitor things without those, but now we have new testing that's coming along, the circulating DNA. I think that's going to be cheaper and replace it at some point, but that, in my mind, still the gold standard. And then my wife, Michelle, she's been the human guinea pig for this whole thing. It started with Michelle and my dad many years ago, and you know, I reversed my dad's cancer, and then Michelle had her issue, and you know, so we became full-time cancer research at that point. So here's the business opportunity with Standard Enzyme and TrueRife. Every single, many of you have a TrueRife machine, and we used to have a scanner at TrueRife, and it didn't work very well. Just be honest, so we quit making it. And so we want to partner with Standard Enzyme and the Vital, and what we would like, and we're going to promote the heck out of Standard Enzyme, and we want to push patients to you guys, because every single day we have 300 phone calls a day that we answer at TrueRife. We got 4 people answering them. A lot of this is to do with scanners. Where can I get scanned? We want to be able to tell them, and so we're trying to get a list of all you guys that want people sent to you to be scanned around the United States. And on the front of our website, there's a little box with a map in it. So if you want to be on and be a practitioner for scanning, you can be on that, and we're going to push patients your way. And so we've been talking, we're going to talk more to Michelle, and we have to have a business proposal, because many people want to combine Vital and TrueRife. It's a business, and it can be a very lucrative business, as many of you guys know. And so if you want referrals, contact TrueRife. We'll put you on the website. We'll start sending you patients. In any big city, we could make someone profitable instantaneously, because like Miami, Chicago, Detroit, we get calls every single day from those big cities. Yeah, Atlanta, Georgia. Yeah. So Hippocrates Research Foundation, it's really kind of a virtual, we do have a physical location, and it's in the Woodlands, Texas, but we really do most of the coaching by phone, Zoom, text, email, and so we really don't, we get mail there, that's about it. But so Hippocrates Research Foundation, and that's how all this is put together, is through Hippocrates Research Foundation. It's a nonprofit, and it studies the intersection of metabolism and disease. That's our website if you ever want to get in touch with us. If you want to refer a patient, or if you want to get, you as a practitioner want to be coached on how to reverse cancer using the Press Pulse protocol, we'd be happy to help you. So here's, you saw patient Dennis Stacy at the beginning. Here's Dennis now. You want to meet Dennis? Come on up, Dennis. Daniel, come on. Michelle.